I think it was when I was a teenager, I realized that when my family always thought chiropractic first, like we didn't really have much sort of need for kind of medical doctors, I guess. And that's where we would go when we were sick or anything like that. I think that that's where my sort of obsession with kind of chiropractic started. The sort of way that I work with my patients is that I always try and really feed back to them what their own physiology is showing me. So if a woman is ovulating, I'll be, explaining to her, look, this is how this is presenting in your body right now. Or as you would know, Angus, sometimes if a woman's period's late and she gets adjusted, then, that can be enough to like trigger that period to come on. And that's the sort of thing as to how I got the nickname of the period whisperer. My absolute passion really is empowering women to, make better health choices because their health has that greater purpose.
Andrea, welcome to the Marketing Your Practice podcast. How are you, my friend?
Oh, Angus, thanks so much for having me. It's an honor. I'm great, thank you. And I love your t-shirt as well, by the way. Experiment for Miracles. It's great.
This is talk about great branding, which we were chatting about beforehand. This is the wonderful and amazing Tony Ebel. And I've done some work for Tony. And so as a part of that, he kind of kidded me out. And I've just had these in so many. It's so interesting, the conversations that this t-shirt brings about from complete random strangers. I'll be walking along and they'll stop and want to talk about it. It's remarkable. It really is. I've never had anything else that I've ever worn that has literally stopped strangers and then want to start a conversation. But this kind of expect miracles does. So yay to Tony Ebel with that too. And look, I'm fanboying out here as well because I've been a fan of yours for, I think maybe I first heard you speak 3 or 4 years ago. I can't even remember where it was, but there's just such a lovely mix of content and depth, but because sometimes people really know their stuff and they're really fucking boring as well. Like, so,
yes. Yep.
But your presentation was sharp. It was interesting. You're really skilled at it just looked so classy and great. And I'm like, yay, like this is what it should be for chiropractors and for us to really aspire to be. And, since that moment on, I've just been a fan and I've been meaning to reach out to you now for 18 months until I finally went, I've just do that. So thank you for being here now.
Oh, Angus, that's so lovely. Thank you. And God, I'm sure I can be bleedingly boring sometimes as well. So I guess it just depends what you're interested in, right?
Well, if you have, it's not while I've been listening. And I know there's lots of things because I know that, clearly, whether it be you teaching you really in-depth stuff, that there's some things there that are nitty-gritties. But, I've heard you talk for hour presentations and they've all been lovely and engaging there too. Hey, for our listeners that might not know the background story of you and how you came about to be known as the Period Whisperer, and the expertise and the reputation that you've gained. Why don't you just take us on a little bit of your journey to what brings you to here?
Okay. Yeah, Angus, I'd love to. So my obsession, absolute passion, and I think, real sort of life purpose is in women's health. And I think I was probably always destined to be thrown into it because I have 4 sisters. I'm one of 5 girls. And growing up, I pretty much just grew up with all women. There were no men really in my life. And, I had aunties, no uncles. I had female cousins, no male cousins. We didn't even have male pets growing up. So that was just, you can imagine the amount of estrogen in our household.
Yes. Lots.
And I'm sure that so many women can sort of relate to this as well. But all of the women around me were sort of dotted with some sort of, hormonal or women's health dysfunction. And I remember when I was, I think I was 11 at the time, and my older sister, Sarah, had her period and she was screaming the house down one morning. And I ran into her room ready to like save her from an intruder or something, just the noises that were coming from her room. And I walked in and Sarah is lying on the floor of her bedroom, writhing in pain and clawing at her abdomen. And I swear, the exorcist had nothing on her in that moment. And she just had a ruptured ovarian cyst. And if anyone's ever experienced that, it can be like horrifically painful, akin to, a ruptured appendix, for example. And when she was consolable, she was describing that the clawing she was doing at her abdomen, and she was physically trying to like get through her skin. She was trying to get to the source of that pain. And it was pretty terrifying, certainly for her, but also for me as this little 11-year-old thinking, what do I have to look forward to? Like, is this what it actually means to like, be a woman? And my mom had a fibroid the size of a football removed, in her 50s. And because of that, she had a hysterectomy and literally aged like overnight. I've never seen anything like it. I just couldn't believe how quickly she changed. And I think I was a little bit fascinated with that because I just couldn't understand how that could happen so quickly. And then fast forward to sort of the early start of my career as a chiropractor, and I had a patient who came in named Stacey, and this was my first year in practice.
Mm.
And she was referred to me by some other, amazing patients, and they were like, "Oh, Stacey's a bit of a lost cause. You won't be able to help her, but just, you've got to meet her anyway." And in comes this 6 foot Amazonian like Kiwi woman with a personality larger than life. And she was hilarious. But underneath all of that, she had the most significant and horrific suffering that I'd ever heard of, that a woman could go through. And so Stacey was in her early 30s at the time when I saw her. And she described her life in monthly cycles of how much of her life she had lost to her disease, which was endometriosis. And she had the worst case of endo that I'd ever seen. I'd even read about in a textbook. She would hemorrhage for 10 days a month, to the point where she would need to be hospitalized. Her pain was so severe that she would lose bowel and bladder control. She would vomit, and she would faint from the pain. And that was every single month. And she had been through absolutely everything that medicine had to offer. She'd had 11 different laparoscopic surgeries by the time I saw her, and had been through chemotherapy drug trials to try and stop the growth of the tissue. She'd been put into chemical menopause, which just made things worse. She was having pethidine injections every 3 days. It was just unimaginable that someone could be existing and still show up with a sense of humor like that. So she changed everything for me. And after that, I just started attracting like all of these women with similar sorts of things, really. And I just decided that if I really wanted to play in that space, I needed to know my stuff. So I went back to uni and I did 2 master's degrees, so one in reproductive medicine and another in women's health medicine. And that sort of morphed into the way I sort of practice today. And then, we started the podcast with Dr. Ashley Bond, and the sort of way that I work with my patients is that I always try and really feed back to them what their own physiology is showing me. So if a woman is ovulating, I'll be, explaining to her, look, this is how this is presenting in your body right now. Or, as you would know, Angus, sometimes if a woman's period's late and she gets adjusted, then, that can be enough to like trigger that period to come on. And that's the sort of thing as to how I got the nickname of the period whisperer. Mm-hmm. And then, obviously with the work that I do in trying to help women solve all of those horrific sort of, hormonal and menstrual conditions that they can have. And initially I was really resistant to that nickname because I just thought that's really weird. Yes. But I've, with time I've sort of started to embrace it. And I think it is a really good summary of the sort of things that we do. But it's also hilarious to see a man's brain try and tick over when they see or read that title of, or that nickname of the period whisperer. And I've literally had men ask me, but Andrea, where are you whispering to? Like literally, like, where are you whispering to? It's so funny. Men just being such literal creatures that they need details about that. So that's kind of how it all sort of came about. And that was sort of the journey that I had there.
What was there something that drove you into choosing chiropractic as a vehicle to begin with? And was that an avenue just to help people, or did you see that as something that could help in women's health in particular?
I don't think that I had this sort of the interest in women's health consciously. As
Yes.
I was growing up, I initially wanted to be a vet because I am, a bit of a crazy dog lady, and they're my favorite things on the planet. But then I realized if you really love animals, then maybe being a vet is not sort
Mm.
of the avenue that you want to go down.
Yes.
And our family chiropractor was um, such an incredible force of nature. And she always had the answers to everything. Any health problem or any question I had, she always had an answer to it. And she was so incredibly intelligent. And I just, I wanted to emulate that. Like I wanted to be the person with all of the answers.
Yeah, nice.
And my mum, took us to chiropractor since we were born. Like I was fortunate enough to be adjusted since birth, and what you just do with your family is normal, right?
Mm.
And then I think it was when I was a teenager, I realized that when my family always thought chiropractic first, like we didn't really have much sort of need for kind of medical doctors, I guess.
Mm.
And that's where we would go when we were sick or, anything like that. And then you realize that it's not the norm. And I quite liked being a little bit fringe.
Mm.
And
Yes.
I think that that's where my sort of obsession with kind of chiropractic started as well. And I knew that I wanted to be in some sort of health profession. And, the chiropractic philosophy just made so much sense to me.
Yeah.
And then I went to my first DG or dynamic growth seminar when I was 15
Oh, wow.
and drank the Kool-Aid then and there. And that sort of started my love of, like really love of our profession.
Was that a Perth-based one or Gold Coast? Where did you?
It was the Gold Coast. It was when they had the big dynamic growth congresses. And I
Ah,
remember being there and seeing, oh, um, oh my gosh, I can't remember. John Hinwood on stage
yeah.
giving men big bear hugs and kisses. And I'm like, where am I? But
Yes.
then just being surrounded by these people with such strong sense of like just love and purpose
Yeah.
and such conviction. And it was so infectious.
It was an incredible part of my journey too. I had my first DG at the end of first year, so this would have been 1994. I'd just kind of broken up with the first love of my life. I didn't realize it until we broken up. I went, oh, I really liked you a lot. And I kind of ended up there not, and I got into chiropractic for no inspiring reason at all. And there was not much to it, but it was really there. And I can still remember now the hugs at the end, like when it would finish, we would all come together and there'd be
Yeah.
just these big kind of almost conga lines of hugs. And it was healing. It just connected me. I just knew I was in the right
Mm.
place. I missed that. There was, it's something I feel sad for our current generation of practitioners that they don't get that mix of what we got at DG from there also. But at 15, that's wild. Was
Yeah,
there
Angus, I don't think anyone understands chiropractors. Like, I think that this is one of the best things about our profession is other chiropractors.
it's
Because, we
it's
just kind of get each other.
it's home. It is one of those
Yes.
things that
Yes.
we don't. There's so much that can just go unsaid when you're hanging out with chiropractors, and we've got lots of friends that aren't chiropractors. But when we're hanging out with our chiropractic friends, it's so easy.
Yeah.
The topics that might come up, we just know how we're going to feel about it, whether it be political or all those type of things there
Mm.
too. And you can just drop that. I've had times I did wonder for a little while there. I had a friend of mine who was in business and had some challenges and needed someone to come along and run his company. And I had some time off practice. I thought, oh, I'll help you out. I need a break, and I had great associates there too. And I worked in that environment for maybe 4 months and went, it's not until we step out of chiropractic that you realize how freaking amazing it is.
Yes.
So yeah, it's gorgeous there too. Coming back, when you realized that you wanted to dive deeper into the women's health thing, and you're still early in practice, Was there any hesitation? I know with chiropractors, particularly when they're early in practice, and I will ask them, what is your focus in practice and who do you love looking after? Often there's a wariness because they're like, once I get a bit busier, then what I'd really like to do is build a kids practice. But from now, I'm just going
Mm,
to see everybody, which is
yeah.
kind of the wrong way to go about it. But you kind of dived in. Was there a hesitation that, oh, I'm cutting myself down to half the population and then a section of those? Did that thought ever cross your mind?
Funnily enough, no, not at all. I think that I was just so certain.
Mm,
And it just made so much sense. And it kind of morphed into that itself.
mm,
So, I was still practicing full time and studying full time as well. So I didn't actually take any time off practice to do that. And I just, obviously started attracting so many of those women, and they would all ask me the same questions. So
mm,
I started then running little workshops at the practice around, the info that they really needed. And I just loved it so much. But then I think because those women trusted me as a bit of a resource of knowledge, or health knowledge for them, then they also brought their partners as well. So, and I do still see men, certainly, but my absolute, sort of area of expertise is in women's health.
yeah. And so would it seem that from the moment that you really committed to kind of going deep in this and getting the knowledge and running the workshops, there was an increase in number of people that came to see you?
Oh, absolutely. Yeah.
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 And
Um,
how are people finding out about you?
um, It was most like in early on in my career, I was fortunate enough to just have developed some just really great relationships with
Mm,
some influential people in our sort of circles. And so I had a lot of pharmacists who referred to me, which was an incredible, source of referrals who I still see today. And they're just, amazing switched on people who obviously see so much disease in the work that they do, and also they're so committed to the people that they see as well, because they are
mm,
so intimately involved with so many people's lives that come into their pharmacy. And then I had a functional gym that would refer to me, just sort of that very much along the lines of our philosophy. And that was just some really amazing sort of pillars for my initial sort of practice growth. And then I absolutely forgot your question. Where
No,
was I
just
going
just
with
in
that?
terms of because this pathway, and I think you're just such a golden example of it, is I committed to just getting really good at an area and
Oh,
understanding it through
yes.
information there too.
Yeah.
And then whilst I narrowed down my scope of practice, it got busier because I had internal referrals coming to
Mm,
me as well. But
yeah.
to continue on that path, like those relationships, whether they be through the gym or through the pharmacist and stuff like that, how
Mm.
did they come about?
There were patients initially.
Yeah.
Um, so and it was funny, I feel like it all comes back to like almost like one individual person. When I was at uni, I had a patient through the student clinic, and his name's Min. He's still a good friend of mine, and still a patient now. And he actually worked at the uni in the oh, in the marine science department. And so he'd seen so many different interns through, like, he would just get adjusted by whoever was there. And he had chronic insomnia, like severe debilitating, like this guy does not sleep. And I had come from an SOT background. So, there was a few more tools on my tool belt, and some of my mentors as well, like people like Damien Christoph, for example.
Mm,
I'd learned so much about nutrition and lifestyle and everything along my journey that I had a few tools on my tool belt to help him. And, within a few weeks, he was like sleeping through the night. And so he followed me everywhere. So, he didn't get adjusted by the student clinic once I left there, and he came followed me, and he was from this big Vietnamese family. And so
mm,
I saw all of them, and then that sort of trickled on to, the pharmacists and that. So he was sort of like the trunk of the tree that then all the branches kind of came from.
yes.
And it was just one of those things that sort of was meant to be. Um, and then I think also in the after I started studying, we started the podcast
Mm.
with Dr. Ashley Bond, so Wellness Women Radio, and I think that we started that at just a time that was right.
Yes.
In the sort of podcasting world, and it kind of went off like
Mm.
gangbusters initially. Like we were so lucky, and that was certainly a source of referral as well, because women were getting information at the time where they weren't getting that sort of thing anywhere else.
Yes.
And so that was also a really great thing too.
And so, because I want to explore that too. So, when you started the podcast, what was the purpose behind it? What was the goal?
So initially it was, oh, the purpose was to be almost like a filing system of the common questions that we get asked in practice that, you don't have time in your regular adjustment visits to go into, but I always wanted to be that resource of information
Mm.
for my patients, and that the information that they would get from us and the level of information they would not get anywhere else.
Mm.
But you can't have those with every single patient that you see each and every visit. So we
Mm.
initially thought we'll start a podcast that at the time there was lots of men's health podcasts, but not many that were really delving deep into women's health. And that was obviously our passion. So we started that, and that was the purpose of it. But it grew really quickly. And now it's sort of just whatever we want to talk about now, really.
How many episodes in are you to the podcast now?
Oh, like 300 or something.
Mm.
Initially, we released every week. We
Yes.
were religious with that. And then Ash had a couple of kids along the way. So, and
Yeah.
then this year in particular, I think, um, just especially for me, I've been traveling so much this year, and it's mostly been sort of work related things that we've probably released the least amount of episodes this year. But the quality of the information that we're releasing gets better, but our actual podcast releases decreases, but that's okay because there's still like a huge volume of
Yes.
backlog that they can go through.
Totally. As I looked across both your websites for the practice, which is now Sage Wellness, and
Sage
then
Health,
also
yeah.
your Sage Health. Sorry. One of the things that really stands across there, and then your personal website as well, is there's just a ton of information, as you kind of talked about before, resources there to help people. In terms of expert positioning, has that been conscious? Has that been something that do you think it's been helpful in creating the brand that you've created?
Has it been conscious? Oh, good question. I never thought of myself as a like an academic.
Mm.
Um, but now I think that I probably fit that bill a little bit, because now I'm lecturing at ACC as well. So I
Yes.
guess I do kind of fit that bill now. But I always wanted women to be able to have resources so that if they're asking questions to other practitioners, like their GP, for example, and for example, let's say they're on oral contraceptives, but they have migraines, which is an
Mm.
absolute contraindication to being on oral contraceptives or combined oral contraceptives. And I wanted them to have that information so that they can have informed consent. They can really understand the risks and the benefits of the choices that they're making, and be able to go back to their GP and say, is this really the best choice for me? And often the feedback that I'm getting now is that sometimes, the other practitioners aren't even aware of that.
Mm.
So hopefully that's having a ripple effect onto more of their patients as well. But I
Mm.
really was invested in them having quality information, and one of our core sort of values at the practice is that we know our stuff,
Mm.
and that they will get information from us that they will not get anywhere else.
It I think one of the things nowadays when we're looking for anything, whether it be to service our car, like I want to take my car to an Audi place, not just to any Audi place. And then,
Mm.
there's experts and specialists kind of everywhere, particularly kind of in the healthcare market.
Yeah.
And if I was a woman and I wanted, and I was looking around for a chiropractor and I came across your practice versus the average Joe Blow chiropractor, there's no choice that I would like, this is where I'm going. This is, for me, it just
Mhm.
screams from the coloring to the language in there to the professionalism to the photographs to all of those type of things there too. It, when I look at it, it kind of makes me feel really proud to be a chiropractor because we often don't do those things great. There's plenty of examples of, things being slapped together and language not great and all of those sorts of things there too. And I know that this is not the reason why you have done it there too, but if you were to step aside and say, look, if this whole idea of me kind of heading down this path of women's health, if you were to just look at it from a business model point of view, how helpful do you think it has been in helping you to be successful in those terms?
Oh, hugely. I think it's that old adage, if you talk to everyone, then you speak to no one,
Mm,
if that sort of makes sense. And I think that that is definitely true for myself as well. And while I love you know, adjusting kids and certainly really enjoy adjusting men sometimes because it's just so simplistic, right? And it just, there's sometimes it's like a breath of fresh air when I have one of my just like easygoing male patients that I'm going to
mm,
see. But my absolute passion really is empowering women to, make better health choices because their health has that greater purpose. And it also allows me to be a little bit single-minded and single-focused too, because I don't think that we have the bandwidth to be able to be an expert in everything,
mm.
you know? And especially I think the way that chiropractic is going, where if you want to call yourself, say, a women's health chiropractor, then you have to have
Yeah.
qualifications to be able to support that. Same with pediatrics and everything else. And I just don't think that, we can have the bandwidth to cover everything.
No, I mean, the mere definition of expert means that there needs to be a narrowing of focus there too.
Mm.
Let me explore this idea of expert for a while because I feel like there might be some listeners out there that are thinking, I really like this women's health thing also, but I don't have two master's degrees. And that's the barrier that stops them from getting into that. Is that a
Yeah.
reasonable barrier?
Um, no, I don't think so because I certainly wouldn't recommend doing those
Mm,
courses. I think that that just gave me the confidence to source the information that I was and to have the conversations with other practitioners and then to, um, now with the experience that I have as well, really feel confident in the work that I do and the things that I say and the advice that I'm giving. But they definitely don't need to, I think, go down that rabbit hole of master's degrees and everything else. But I am quite protective of women at the same time. So I
mm,
also think if someone wants to call themselves a women's health expert, that they actually need to know what they're talking about,
mm. Yeah.
because there's enough, doTERRA coaches, for example, or doTERRA saleswomen who call themselves women's health or hormone experts, and it means nothing, right?
Yeah. Totally.
uh, yeah,
It's a real concern and one that I chat with chiropractors a lot. And my comparison is often, you know, the personal trainer who's now a health expert after a 12-week personal trainer course.
hmm
And yet I have chiropractors who are not comfortable calling themselves spine experts after 5 years of, I'm like, there is no one that understands the
yes,
biomechanics of the spine, like no one, not surgeons, not physiotherapy, like nobody has the
yeah,
hands on. And if you and and it's a cautious path to work, but I tell most people that, you know, if over this next 12 months you were to read maybe the 20 best selling books on that area, like if we were to pick women's
mm,
health, and choose your books carefully, and then maybe do a few seminars like Andrea's there too, within a scope, you probably certainly can say, I have an interest in women's health.
yeah,
Um, and,
yeah.
and, you know, I think we hide behind, needing master's degrees and these type of things and PhDs, mostly because it's just a lack of self-confidence. And for many people, we can even have
Yeah.
that. And then there'll be another reason why not to hold back there too. Is that an oversimplification, or what are your
No,
thoughts?
I wholeheartedly agree, Angus. And especially I love how you're talking about, after 5 years, you are this, if you've been in practice for 5 years, of course you are the spine experts. No one knows that like we do.
Mm,
And when I'm teaching chiropractors as well, particularly techniques like, dysmenorrhea or period pain control techniques or those sorts of things, like there is no one who can do this stuff better than us because we also have got such incredible palpation skills.
mm,
There is no one who has the sensitivity that we do, right?
mm,
That can pick up, variations and changes in someone's, system the way that we can.
mm,
And also the knowledge that we have of anatomy and physiology and everything else that is I really think that we have this potential to be leaders in women's health, particularly in certain areas of it that no one else can do like we
mm.
can.
Yeah.
Um, and
And that,
yeah, I really want chiropractors to step up into that. That's what I'm trying.
and there can be a lens that we could go through this, because maybe if they don't have the functional med background that you do, then maybe that might impact some of the nutritional or supplemental advice that they give. But then it's like,
Sure.
find someone to work with you. Like, you
Yeah.
know, it's easier to find that person than to find a chiropractor who has the skills and the understanding, the lens through which to look at a, nerve system first subluxation based kind of vitalistic model.
Mm,
There are plenty of naturopaths and stuff that we could work with as well. You're now
absolutely.
working to, because you've gone from, okay, I've got my weekend seminars,
Yeah.
and now, and I only just realized this recently, I have some mutual clients who are doing your work too. Like, there's a whole kind of 12-month course that you're teaching,
Mm,
um,
yeah.
as well. Um, Tell me a little bit about the journey of that, and what is that to help chiropractors with?
So as you mentioned, I initially started just with the kind of teaching filter was doing some speaking at our various seminars and those sorts of things, and people really enjoyed some of that content, and some of them started to get in touch with me about some more training. So I built out a women's health essentials 1 day women's health seminar for chiropractors to give them some essentially women's health 101, but also teach them some period pain control techniques and just also show them the incredible impact that they can have without actually changing anything, but just having a different filter to think through. So even just, for example, 95% of women have period pain. And one of the things that can contribute to that, which is an independent risk factor for period pain, is actually the position of the uterus within the pelvic bowl, which is dictated by the pelvis, the sacrum, all of those sorts of things. So adjusting someone is absolutely going to have an input, even if you just think about that biomechanically. If you boil it down to just, even that, it's so easy to see the correlation there. And then from there, I really am so passionate about fertility. So Dr. Ashley Bond and I started teaching a pregnancy and fertility series. And the questions and the rabbit holes that we would go down from some of those just made me realize that chiropractors want so much more information, and that the feedback that I got a lot is that they wanted to practice the way that I do as well. And so that's how I built out Women's Health Mastery, which is the 12-month diplomat program, which covers, I ambitiously wanted to try and teach them everything that literally everything that I know, every single topic. So from dysmenorrhea or period pain and all of the, technical side of that for how you can work on that in practice as well, to perimenopause, menopause, fertility, pregnancy, PCOS, everything along that spectrum. And so it's over 12 months, like it's fairly akin to, without being like a master's degree in this,
Mm.
with some, in-person weekends for technique and everything else. And it's
Is
amazing. I love it.
Yeah. Is that only available to kind of Aussie docs, or do people need to travel for that? Is it internationally available yet?
I haven't made it internationally available yet, but I would love to. There will be a little bit of travel involved because part of the requirements is at least two in-person
Mm,
weekends. So there's a couple of intensive days that we do, which I think has also been really important because of the tribe that has been created there
yeah.
as well, and the other chiropractors who are doing it are just. I feel so fortunate to have been able to connect these
Yeah.
women. Like it's only, interestingly enough, women who've done it so far,
I
which is
noticed
fine.
that in the photos.
Yeah.
Yes.
Yes.
Yeah.
And I would love to take it internationally, and maybe that will be something that I work on next year as well.
What what advice would you give chiropractors who are starting out or maybe in practice who have a niche, a special interest, whether it's sports or office workers or old folks or babes or anything like that too? What advice would you give them about kind of narrowing their niche and diving into like where their passion is?
Oh, um, the first thing that came to mind was just to be unapologetically passionate about it.
Mm,
You know, I think I've been so fortunate that I love what I do so much,
mm,
and I'm like absolutely obsessive about it, because I am so passionate about it, and I cannot imagine what practice would be like if I wasn't really that interested in it.
mm.
And
It-
I just feel
mm,
like, it would almost dull the the tone of everything. So if it's something that you are really passionate about, if it's an area of interest, then, and it could be sports, it could be pediatrics, it could be, you know, anything. But I think that that passion is palpable and
mm.
such an attractive force as well.
Yeah.
Um, so
It,
yeah, I
it
think, yeah.
it clearly is with you. And I think to because and you raised this point beforehand too, because often sometimes people say to me, I just don't want to look after just women. I'm like, I
Mm,
get it. And fortunately or unfortunately, it's not that easy that you just talk to women and they're the only people that will come in because,
mm,
these women have husbands and children,
yeah.
and parents and stuff like that too. And you get to say yes to no to those if you want to also. But
Mm,
I think we have, our time is so precious. And if we're in practice, why not be there dealing with people who we really love to deal with and that we can be
yeah.
passionate about there also? What's next for you in terms of practice wise, but then also bigger picture in terms of Dr. Andrea?
Mm.
What's coming in the next 24 months?
Oh, well, I mean, practice-wise, we're actually next year moving the practice into like a much bigger space.
Yes.
So that will be amazing. And that's sort of where all of our focus as a practice is at the moment, is sort of putting that together, which will be incredible. And then also it being sort of a little bit more multidisciplinary, all in the support of sort of women's health.
Mm,
And I'm fortunate enough to work with two other amazing chiropractors,
mm,
who also have a focus in pregnancy and pediatrics as well. So we sort of try and cover as much of our women's health basis there as
mm,
well. And then in terms of my teaching, I think it will be the expansion of the diplomat program,
mm,
and hopefully Ashley and I plan on going to Europe next year and doing some of our seminars over there. But I would love to also go to the US, and do a bit of teaching over there as well. I'm a part of a few women's health groups, just, international chiropractic women's groups. And the questions that come up so often are
mm,
so around that sort of women's health topic. So I feel like they need some more really good quality information.
mm,
But I've just got to figure out how to fit that in and the time for that. Um, so there's that. And then, I wrote the curriculum for ACC for women's health. so that the next generation of chiropractors will hopefully be fully aware of the impact that they can have. And so I don't know, maybe more in the academia. We will see.
Yeah, well, I'm super excited to see what comes next. As I mentioned before, it makes me really proud to be a chiropractor when I see such great quality content, such lovely branding and amazing work all happening under the umbrella of really lovely vitalistic stuff. It's, as we talked about beforehand, or we talked about DG, it's just so nice for us to be around, our own peeps with regards to that too. Can you share, if people want to find out more about you, and I'll have all these links in the podcast and stuff like that too, but where are they best to go and have a look to learn more about Andrea?
Well, Angus, first of all, thank you for saying that seeing that stuff makes you proud to be a chiropractor. That is such an incredible compliment. So thank you. And as I said to you offline, I don't feel like I do it that well, but thank you. I appreciate that. The website's probably the easiest, which is just drandrea.com.au. Or, obviously I'm on Instagram as well, which is at drandrea.exo.
Great. I'll have all of those links there as well. Hey, thanks so much for being ace. And I can't imagine the hours that you have put into this. And I think you're laying the foundation for a really lovely legacy for chiropractic and women's health. You're inspiring loads of, young and, experienced chiropractors as well. So thank you for all that you do.
Oh, thanks, Angus. And thanks so much for having me. It was lovely to chat.
Pleasure. Nice to talk about something. Well, not actually nice. Different to talk about something that's not women's health related, perhaps as well.
Yeah.
So we'll talk. And again, we didn't get into any of our questions. I had a whole bunch of dog questions because I'm a dog lover too. But maybe we can.
Damn it!
We can hold that for round two. So
it's the only thing I love more than women's health.
Yes. Yeah, I know. I'm often people ask me, are you a dog or a cat person? I'm like, I'm an animal person. Grew up, my mum worked at the RSPCA for a long time. I lived at the RSPCA for a number of years. It's both a strength and a weakness of mine is my love for animals. And sometimes I wish I didn't love them so much. But they bring an enormous amount of joy. And I can see that you are as invested in your four-legged furry friend as we are with ours as well. So on that note, we'll talk again soon. Thanks, Andrea.
Thanks, Angus.
If you've enjoyed listening to this podcast, you have to come and check out my Community Influencer Program. It's my monthly coaching program where we take all this material and I'll work with you to help you apply it, implement it, and systemize it. The Community Influencer Group Coaching Program is designed to help you increase your practice income, impact, and enjoyment. Join me over at anguspyke.com/join. That's anguspyke.com/join. I'd love to see you there.